To elaborate a little bit more on his work, these are images of pancreas. On the left panel is a normal pancreas. And what you see out there is the insulin-producing red beta cells, and the green cells are the glucagon-producing cells. Type 1 diabetics, they don't have any beta cells, so they don't make any insulin. And type 2 diabetes has hypertrophied cells in terms of their beta cells. But what's important is that there is close juxtapositioning of the alpha and beta cells. And the question that Dr. Unger posed to himself is that, is this an accident of nature, or is there a functional role? And I'm paraphrasing him. Paracrine means local control. Endocrine means that insulin is being produced in the pancreas, but it's having effect on the brain. So insulin begins its journey in the beta cells, and the highest concentration of insulin is seen at the level of the alpha cells that are making glucagon. The role of the insulin is to shut down glucagon. By the time it reaches the liver, it is diluted by about 10-fold, and by the time it reaches the regular circulation, there is a 100-fold dilution. A burnt out type 2 diabetic and somebody who is a type 1 diabetic, exogenous insulin can never duplicate this physiologic situation, because the liver will never see the concentration of insulin that nature designed for us to see. So why is this the case? And the reason this is the case is that as there is slight fluctuations in sugar, the beta cells release insulin in a phase 1 response. You see that spike out there, that little squirt. The reason that squirt is there is because it can suppress glucagon. And it continues to suppress glucagon through phase 2. What it is telling is that, hey, in a situation in which you are not eating, this is what glucagon is doing. Because glucagon levels are high, it's telling the liver, put out sugar, burn the muscles and convert them to sugar, take the fat, the glycerol from the fat, convert it into sugar, and take the fat and convert them to ketones. So the paracrine interaction between the alpha and beta cells, when you're eating, insulin is telling, hey, use and store sugar, build new protein, pack fat and store fat. On the other hand, in situations of scarcity, it's telling, the glucagon is telling, make and release sugar from the liver, break down protein to make sugar, and release fat and perhaps convert them to ketones.